switch gears, we talked about the importance of obviously our veterinarians and our horse health program. And this is a topic that comes up a lot, and it's not just prevalent in times of a global pandemic, but right now I think it's extra important that we know what our emergency kit must-haves. What are, the first aid essentials that we should have on hand? We do a lot of preparations for ourselves right now. I mean, we're trying not to go to the grocery store every other day. So as you're thinking ahead for yourselves, it's a really good time, if you haven't already, to think ahead for your horse. And, if you're going to be getting those spring vaccines done, use that time to go ahead and, ask your vet for some first aid equipment that you might need, or the next time that you're at the feed store, maximize that trip and get some extra vet wrap and get some tools that you can stockpile, so you can minimize those trips as well. So I think we're going to take this chance. I'm going to let Dr. Donata maybe talk about, from a vet perspective, what are some of the things that they can give to you as a horse owner for you to keep on hand, versus some of the things that they can't just give you a large bottle of and let you have at it. There's certain things that they need to administer. But I know as a horse owner, things like bute and Banamine are really important to us. And maybe she can describe the process of how a horse owner would get a hold of those things for future use. We'll start there.
Sure. And so the first thing I would recommend is that if you're looking for a good list for a basic first aid kit for your barn, for your horses, Google it. There are some really nice resources through thehorse.com, which of course is the Horse Owner periodically that comes out every month or so. AAEP has good resources, and so there's really nice published with good pictures and nice lists of things that are helpful to have in your emergency kit. Caitlin and I also have some lists that we can post on her website for resources in case you have a hard time finding them. But in general, things that will allow you to deal with minor common injuries or illnesses on the farm. And so what are horses going to do on the farm that maybe you can handle without having to involve a veterinarian or have a veterinarian out? Or even if you call the veterinarian, if they have you care for it yourself, what supplies will be helpful? And Caitlin already touched on a couple. So basic wound care, perhaps some triple antibiotic ointment like Neosporin, gauze so that you can clean and perhaps keep a small wound clean, betadine or chlorhexidine wound scrub or wound spray. Any spray that you can get at the local feed store or even at the grocery store for human wounds are probably going to be also effective for equine wounds. Basic bandaging material, and so vet wrap, roll gauze, things so that you can reduce swelling, so standing wraps, even polo wraps can be helpful. And again, if you're not comfortable using those, then by all means call your veterinarian, involve them, send a picture of a wound if your horse comes in with a cut on its leg. Remember that some cuts, in some lacerations and wounds in horses can be small and look completely innocuous. Really, they look like no big deal. But if they are over a joint or over a tendon, they can actually be true emergencies. And so talk to your vet and then go by use their advice as guidance. Basic medications, anti-inflammatories and pain meds like bute, many people are able to carry a small stockpile of those medications, and those are prescriptions, so you would need to get those from your veterinarian. Banamine is good for colic, also a good anti-inflammatory and pain med, so having that on the farm in case your horse gets a fever or starts to show some signs of colic is a good idea. And then the other emergencies that happen to horses on the farm are eye emergencies. And eyes, if anybody has had a horse that had an eye emergency or had an ulcer at any time, you know how bad they can go very quickly. And so having some basic eye wash and perhaps some eye ointment, some triple antibiotic eye ointment is also a good idea. And those you can get certainly from your veterinarian. As far as tools, it's always good to have a stethoscope. You can buy those at your local CVS or online. They can be under $10. You don't have to have the fancy ones, but a basic stethoscope will allow you to take your horse's vital signs, listen to its heart, get a heart rate, and then a thermometer, of course, which are a little bit difficult to find right now, but a thermometer allows you to make sure that your horse doesn't have a fever. All those are really helpful when your horse has either an injury or perhaps isn't feeling well, and you need to be able to get some information on your own to provide your veterinarian.
Yeah, I think that's wonderful. And another point to make is we don't want horse owners to feel like this is the wild, wild west and that there's no, use for your vet right now. They definitely have a place. And like Dr. Donata said, hopefully you have that relationship established so you can pick up the phone and call them. I mean, let them know what's going on and they can guide you over the phone, send them pictures. Don't totally try to take care of everything on your own. This is just for those slight emergencies that, you guys know what we're talking about. Your horse comes in with a scrape or they have an abscess or, something mild. But I mean, if your horse is bleeding profusely, three-legged lame, has a severe eye issue, then definitely that is essential. And, when it's life or death or severe discomfort, you need to involve your veterinarian. But as far as the first aid kit goes, the list can be exhaustive depending on who you talk to. So definitely the recommendation stands from Dr. Donata. There's plenty of online resources where you can get helpful tricks and tips and, brief instructions on how to wrap. That's another thing that, as she said, you can do more harm than good if you don't know what you're doing. So don't try to, pick your injured horse as the first time you learn how to wrap a tendon. That's not probably the best case scenario. In times like that, it might be an emergency where your vet needs to come for you, but not someone else if you are not familiar with the process of wrapping a leg. So this is a good time to kind of look through your barn. I mean, if you have some extra time, clean your stuff out, see what's old, what needs to go, what do you need to revamp? Will your vet wrap still stick? So it's a good time to kind of take inventory. And even after this is over, you always should have your equine first aid kit available and ready. So this is a really good time to make sure that hopefully you don't need it, but if you do, that'll take some of the stress off, knowing that you can kind of buy yourself some time or handle something completely on your own. The next thing that gets asked a lot, and some folks were wondering what the current recommendations are for deworming. And so I was wondering, Dr. Donata, if you could kind of explain in somewhat simple terms what shedders are and kind of the new recommendations for developing a deworming and parasite control plan for your horses.
Sure, and real quickly, I'll just make a comment about wrapping. You're absolutely right, Caitlin, that this is probably not a great time to learn how to wrap a leg or a tendon for the first time without any guidance. And so I was actually looking on the website, the Horse Extension website, just yesterday, and they have some really nice guidelines with great photos of how to wrap a hock, how to wrap a fetlock, and how to do it properly so that A, the bandage stays on, which is always a good thing, but also so that you don't create pressure sores or do any damage to underlying structures. So take a look online. There's a lot of good info out there, and when in doubt, just always involve your veterinarian or your local extension agent. They're often very good at wrapping horse legs and have done first aid educational training all over in their respective counties. And so there are also really, really good resources for these kinds of things. As far as deworming, so as hard as we've worked to get people on board with running fecal egg counts in their horses to identify the shedders, those are the animals that persistently carry higher loads of parasites than others. And this is due to natural immunity. So in a herd of say 100 horses, you may only have 8 or so that actually persistently carry high loads of parasites and shed multiple higher levels of eggs, which are infective, into the ground and then into the grass, where they turn into larvae and then serve as infection sources for the rest of the horses in the herd. So believe it or not, most horses are able to maintain fairly low levels of parasites even without our well-meaning interventions. And so there is a difference in how many times a year horses need to be dewormed based on if they are one of those natural high shedders versus a low shedder. Unfortunately, right now, fecal egg counts are going to be considered non-essential veterinary procedures. And so until this pandemic is over, empirical deworming would be recommended. And what that means is deworming your entire herd, not based on fecal egg counts, but just as a preventative measure. And in adults, ivermectin is the recommended dewormer. It is the most effective against small strongyles. Ivermectin or moxidectin, although we're trying to save moxidectin, which is Quest, for horses that are more clinically affected as more and more horses become carry resistant parasites, and that becomes a bigger problem. Ivermectin is what I usually recommend. And luckily in Florida, we are getting into that hot season where the environment is going to be too hot to support the life cycle of parasites on pastures. And so we often recommend deworming in the spring, just before kind of late spring around right now, because as soon as the weather is up in the mid 90s, the parasites actually will not be able to complete their life cycle. And so most Florida horses don't need to be dewormed through those really hot summer months. Again, without a fecal egg count, it's shooting in the dark a little bit, but I think given the current circumstances, it's better to just protect your herd, make sure that nobody's going to end up with clinical parasite problems in this pandemic time, and then pick up your fecal egg counts and only targeting your high shedders when all of this is over. If your horses have not received praziquantel, which is the compound that is effective against tapeworms, if they have not received that in the last year, then when you deworm them with ivermectin this spring, make sure that it is something that includes praziquantel. So that would be your Zimectrin Gold. There's generic versions too, or Quest Plus would be moxidectin plus praziquantel. All horses need to receive tapeworm treatment at least once a year in Florida. If you have animals under a year old, then fenbendazole is the most effective deworming agent, and that is effective against ascarids or roundworms, which we know young horses are more frequently affected by, and they can become very sick and colicky and actually require surgery if their roundworm loads get out of control. And right now, and through the summer, is when we see the worst cases of those, because we have lots of weanlings on the ground who tend to be like to have high loads of roundworms. And so it's really important to not forget those guys. Ivermectin is generally not effective against roundworms or as effective. And so fenbendazole is really, really important. So that's going to be your Strongid paste. And we often recommend deworming the young stock every month until a year of age to make sure that they don't develop those ascarid loads. And then after that, using ivermectin along with the other adult horses.
Very good. That was I might have to pause that and rewatch that a few times, but that was a very good description of the basic products that are out there, times to use them, and their importance right now, and kind of how we shift our treatment protocol in the times that we're in. The next question, I'm going to kind of throw two of them together that were asked, and they both kind of deal with the seasonality, or the season that we're going into, our rainy season and our summer itchy season. So I have a question here about treating or maybe preventing no-see-um bug bites, and rain rot is another common question. Is there any prevention for it? I know there's a lot of recommended treatments, from, home remedies to everything you can buy over the counter at your feed store. As a veterinarian, what do you think an owner should do in prevention and treatment of bug bites and rain rot?
Great. So both of these conditions are pretty frustrating from an owner standpoint, and horses can get so severely affected that veterinary care is actually needed. I think it behooves everybody to try to identify these problems early during this current pandemic time, and then try to initiate any treatments or preventatives that you can on the farm, so that hopefully your veterinarian, it will never get to a point where the veterinarian has to come out on an emergency basis. And with everything we're talking about today, vaccine guidelines, deworming protocols, preventative medicine, your vet knows you and your horses and your farm better than we ever could over a webinar, of course. And so if anything that we say today doesn't exactly align with perhaps the advice you've gotten from your veterinarian, always just refer to your veterinarian, because again, they have that relationship with you and your horses and know the preventative health care that they've initiated on that farm in years past. But we can start with the no-see-ums. So these are midges, and the scientific term for them is culicoides. And that's important because if you Google it up, if you look for culicoides hypersensitivity, or sweet itch is the layman's term, there is also great information. I've read some really nice reviews or articles on this in the Horse magazine. And for those of you who are not familiar with the Horse, they have a really nice online portal. You can search all of their articles over the years. Really, really great, easy to understand, easy to follow guidelines for just about every horse health care problem that you can imagine. And so midges and no-see-ums are everywhere, and they don't generally cause anything more than an annoyance unless your horse is allergic. And so if they have an allergy or a hypersensitivity, those horses actually can become severely affected. And I have a picture here. There's a very classic presentation of these guys. And if you Google sweet itch, you'll probably find some more photos, but I'm going to share my screen. Caitlin, can you see that? Yes. This is a mare with culicoides hypersensitivity or sweet itch. And so the classic areas are when they will rub their tail out. You see she's been scratching her hind end here, and they actually excoriate and injure themselves because they are so itchy. Limbs are often affected, their face, you can see her ears. She's scratched off all of the hair on her ears. And then their mane, horses that lose their manes from itching this time of year are also probably have culicoides hypersensitivity. And this can be so traumatizing that they develop bacterial skin infections where these open wounds are. And they can be so affected and so itchy and so miserable that they stop eating because all they want to do is try to itch. So this can actually be a very serious medical condition. If your horse is this severe, then definitely you need to call your vet, because this horse probably is going to need some antibiotics to cover for underlying infection here, and probably some anti-inflammatories, maybe some steroids to try to get this inflammation quieted down. But if your horse has more mild signs, maybe just the tail rubbing is often the first sign, or the itching of the mane, or some hair loss in small areas but the underlying skin still looks okay. There are some really nice management protocols that you can institute. And one thing to know is that these no-see-ums are most active in the morning and in the evening. So dusk till at dusk and dawn. So keeping horses that have hypersensitivity to these culicoides midges inside during dusk and dawn hours can be really helpful. They're also really poor flyers. And so putting your horse inside under a fan or under several fans. I've seen owners very successfully manage horses with severe allergies to these midges by just essentially making their stalls similar to an airplane turbine in the mornings and the evenings, because the midges really can't fly if there's any air movement at all. And of course the horses love it because they're nice and cool. They think they're on vacation. So making sure that there's good fan support can be really helpful. Using fly repellents is really important too. And so a 1 to 10 dilution of pyrethrin is a good cocktail for fly or as a fly repellent and an insecticide. And these are the horses that really need to be doused with that. Have a really heavy spray at least a couple times a day, if not more often. They're not the horse that you can lightly mist every few days and they're fine. I think that's it. And then they make fly sheets. I've seen horses that had fly coverings on their legs and belly bands on their fly sheets. It's so darn hot here and humid that they will sweat, of course, under those wrappings, but sometimes it does get to that. As far as, what was the other question? What was the other annoying?
Rain rot.
Oh yeah, gosh, rain rot. That's a problem too. So rain rot is a bacteria called dermatophilus, and it is in the ground, it's on your horse all the time, even when their skin is normal. It is able to proliferate and get into the skin and cause a dermatitis and that classic rain rot sort of scabby disease when your horse is wet all the time. And of course, here in Florida, lots of horses are wet all the time. And so the surefire way to get rid of rain rot is to keep a horse inside where they can't get wet. Of course, most horses don't really appreciate that, and then you maybe will end up with other deleterious effects like stall vices and boredom. And so trying to make sure your horse has an opportunity to dry out at least once a day, maybe bringing him in for a couple hours. Good grooming is important. It removes some of the bacteria and lets the air get access to the skin layers. And then I'm a big fan of Dawn dish soap for this. And so and that's something you don't need a prescription for, of course, you probably have it, just some basic Dawn dish soap, squirt a bit into a bucket of water and do your best to scrub those areas that are affected by rain rot. And that will help decrease bacterial load. It cleans the skin. Remember, that can be quite sensitive. So just be careful, make sure you're not scrubbing so much that your horse is in pain. But Dawn dish soap I found to be really inexpensive and really helpful.
Well, that's good. I know as horse owners, we like when there's a rather inexpensive, simple solution. So thank you for that. And I think the last question we'll touch on is the ever feared EPM. And we really want to know, can a horse fully recover from this? And what is the main treatment protocol? If you could talk to that a little bit.
Right. So EPM is a disease that we see here in Florida. We see EPM anywhere where the definitive host is present, which is the possum. And horses contract this disease aberrantly, meaning the parasite does not complete its life cycle. This is a protozoan parasite called Sarcocystis neurona. Horses are not able to maintain the life cycle for this parasite. And so when they aberrantly are infected by accidentally eating infected possum scat or manure in fields, the parasite in some horses, we don't know why or which horses necessarily are more at risk, but it will travel to the spinal cord and the brain, to the central nervous system of the horse, and cause neurologic signs. And so this is a frustrating disease. Horses are able to fully recover. We think around 60 to 70% of horses can fully recover if treated aggressively. And the treatment of choice is a medication called Panazeral, which is the trade name for that is Marquis. Treatment is usually around a month, sometimes longer in some horses. Horses can relapse, and these would be things you would work with your veterinarian to discuss. One of the most difficult aspects of EPM from an owner standpoint is diagnosis, and that's because definitive diagnosis of EPM requires a spinal tap. We need spinal fluid because we know that many, many horses, especially in Florida where we have lots of possums, have been exposed. Many horses have been exposed but will never get EPM. And so their blood will have levels of antibody that support that they have been exposed. So it's not very helpful from a diagnostic standpoint because most horses, actually up to around 80% of horses in Florida, will have positive titers or positive antibody responses in blood, but may never ever have an EPM. And so it's the horses that have clinical signs, including neurologic deficits. So perhaps they're in coordination in their gait when they're walking and trotting, or inability to know where their limbs are, or atrophy, which is loss of muscle mass in certain muscle groups. Those are classic signs of EPM. Those horses, in order to diagnose EPM definitively, we need to actually get a blood sample and a spinal fluid sample. That is something that some veterinarians feel comfortable performing in the field, while others would prefer that that horse goes to a referral center to have that fluid sample taken safely. Given the current pandemic state, I would say that if you suspect your horse may have EPM and your veterinarian also feels strongly that your horse may have EPM, then initiating treatment rather than referring to another outside clinic or institution for a spinal tap might actually be prudent from a standpoint of minimizing human interaction and human contact. And so this would again be one of those examples where rules that we would follow under normal circumstances, we may actually lax those rules a bit and treat a horse for EPM without that definitive diagnosis right now. The treatment, luckily, Panazerol, is quite safe. There are very few, if any, side effects in horses, even at very high doses. The downside is it is pretty expensive. It can be between $1,000 and $2,000 to treat a horse. So it's not an inexpensive treatment, but it is quite safe. And I wouldn't be afraid to certainly treat my horse right now for EPM if I thought that that's what the horse had. But I would really work with your veterinarian because EPM can masquerade as a lot of other conditions, and you'll want to make sure that your vet agrees that EPM is high on the list before you treat.
All right, very good. Well, I think, so we don't make this too long, we'll wrap it up there. So I want to thank Dr. Donato again for spending some time with me virtually and being able to be the expert to share her knowledge on some horse health and first aid tips, and then also the important updates on our COVID-19 situation as far as it pertains to horse owners. And we will be sure to continue to share resources with you guys as they come available. So stay tuned to all of our social media. If you're not on our email list, you can get in touch with me or any of our CFLAG, Central Florida Livestock agents, and get on their list. So we're doing our best to be virtual and still bring you the same awesome information. So Dr. Donato, thank you again, and stay tuned for more webinars.
Thank you for having me. Stay safe, everybody.